All right, what a busy news day indeed, as Crisaldo was talking about with regards to the taxi fare hikes. We will go back to Crisaldo in a short while. We have to say goodbye to our SABC 3 viewers. Thank you very much indeed for joining us this morning. For those who have access to SABC News, we want to take you now to the Eastern Cape, where the Department of Health will be receiving a consignment of personal protective equipment from China. The province has seen a number of protests at different health facilities due to a lack of PPEs for frontline workers. The province has also seen an increase in the infection rate among healthcare workers in the private as well as public sectors, with over 250 cases and 14 COVID-19 related deaths. Now, Health Minister Dr. Zweli Mkhize also released a statement noting the alarming infection and mortality rate in the province. There's a briefing currently going on. Let's go there now live.
Ladies and gentlemen, Molweni, and good morning. It has been 74 days since the President of the Republic's President Cyril Ramaphosa announced the national lockdown, and so much has been done since then. Like the President has said, the state of disaster and subsequent nation lockdown helped us prepare our healthcare systems. The spread of COVID-19 was slowed down during that period, even earning South Africa praise from the World Health Organization on how the National Command Council has acted swiftly. It is true, we could not remain on alert level 5 because of the devastation that would have had on our already fragile economy. I must say up front that when the sale of alcohol was banned in the country, our hospitals had few to no trauma cases at all. This helped our dedicated nurses and doctors focus all their attention to the fight against the coronavirus. Unfortunately, with the sale of alcohol allowed again, we have seen a surge in the number of trauma cases in our hospitals. At Frey alone, Frey Hospital here in East London, there were 67 trauma cases just in the first weekend. And these are all related to alcohol consumption. It is the same in all other facilities as well. This is why I want to make a plea to the people of the Eastern Cape to drink responsibly. When they overindulge, that has been proven to result in car accidents, stabbings, and general violence, rapes included, which add more pressure to our already overstretched doctors and nurses. We all need to be responsible and not abuse alcohol, or else our healthcare system might be overwhelmed because of the number of trauma cases and COVID-19. Ladies and gentlemen, you would have heard me talking about how our frontline workers are our heroes and heroines before. I will continue repeating that because what our doctors and nurses have been doing since the outbreak of this global pandemic has been nothing short of great. They have gone above and beyond the call of duty and endured those infected by the virus and professionally are cared for. Their efforts have not gone unnoticed, but we must ask more of them still, because this war against this invisible enemy is far from over. This is why we have armed our frontline workers with masks, gloves, and overalls, goggles, aprons, and sanitizers, as we cannot send soldiers to a war without their weapons. And today, we are here to distribute PPEs to all districts as this fight continues. We don't want a situation where health workers are without PPE, which makes them to be vulnerable to the dreaded disease. With the PPE, we are making sure that our health workers are protected at all times. Unfortunately, despite all the efforts by our health workers, we have lost 101 souls, including healthcare workers from both the public and private sector. We would like to send our heartfelt condolences to their families and loved ones, and of those who have died as a result of COVID-19 complications. Your loss is our loss. Sithi akuhlanga lungehliyo thuthuzelekani. NguThixo onikayo ikwanguye othabathayo. Tutwini mzi waseMpuma Koloni. Xa ujonga the stats that Minister Dr. Zweli Mkhize releases regularly, it looks like the surge in new infections has started, and our projections for the winter period and challenge up to September is looking us right in the eye. Upper Epondweni, we have 5,974 confirmed cases and 2,666 recoveries, and that means we have 3,308 active cases, which are as a result of tests done, standing at 64,173. And those recoveries did not just happen. People recovered because our health workers have been hard at work, ensuring that those who test positive make full recoveries. Despite all that has been done, we have been criticized of what some people have labeled as mismanaging COVID-19 in the province, and of not providing workers with the necessary PPEs. That could not be further from the truth. What is true, though, is that we have made mistakes and might continue making them as we go along, because this pandemic is new to all of us. But we are lucky to have an independent media like you that holds us to account, which makes us do better. We appreciate that, as long as you are not being used by faceless people to fight their own battles with the department. People must understand that we have new infections not because of what has been called our incompetence, but because some people are hell-bent on not adhering to the regulations. I say some, because the majority of our people have adhered to the regulations, continue to, and will continue going and doing so going forward. To them, we say thank you. To those who don't adhere to the regulations, to them we're saying it is not too late to change, and in changing your ways, you join us and the rest of us in the fight. We need each and everyone to play their part. That is the only way that we will successfully flatten the curve while scientists continue to search for a vaccine. But as the provincial government, we have been hard at work doing all we can, as giving up is not an option. We will continue fighting the spread of this virus until we get a vaccine. To show that we have not simply been folding our arms and waiting for the vaccine, the department has placed orders worth over 281.6 million worth of PPEs since the COVID outbreak. We've had to divert money that has been allocated to other responsibilities towards COVID-19 programs. And today, here we are, distributing the much personnel protective equipment, which forms part of the support that we have received from our National Health Minister, Dr. Zweli Mkhize. It is not just a gesture. We have called him on board to assist in terms of such. And this is what he has donated to us. He has donated in excess of 1.5 million of 10 micron aprons, 672,000 latex gloves, 105,000 20 micron aprons, 35,000 KN95 masks, 3,000 3-ply surgical masks, 28,250 50 GSM coveralls, 25,000 face shields, 9,360 Lifebuoy bar soaps, 3,072 domestic sachets, and 102 infrared thermometers. In this, we are very grateful. As such, I have invited the minister to come and see the route that we're taking, which of course by his assistance, whether we're on track, and I think in this week he's going to respond to come to the Eastern Cape. Because we've seen him doing good work in Free State, assisting the Free State. We've seen him doing good work in Gauteng, assisting Gauteng. We've seen him doing the best in KZN, and now we're looking at him assisting the Western Cape. By no means, we're also part of those that needs his assistance. So I have invited him to look at his diary. He might respond that he is coming this week. As the Health Department will continue to make budget assessment and reallocations as and when the need arises. Our provincial departments have also done the same, as this is not a Department of Health issue, but a societal issue. Ladies and gentlemen, if we don't work towards one direction, the Eastern Cape will peak too quickly and will not be good for us all. We will continue testing as many people as possible so that those who test positive will get the treatment they need. Our hospitals and quarantine facilities, which include the Nelson Mandela Bay Stadium, which is up and running in PE, are already having people that are isolated in the centers. Equally, in the hospitals across the province, we've managed to add some beds, either by decanting or by engaging on alternative built technology. Fellow South Africans, please join us in this ultimate fight of our lifetime. Working together, we can do and we will win this war. We want to thank the businesses, foundations, NGOs, political parties, civil society, and individuals who have dug deep into their pockets, bought PPEs for both the department, in particular hospitals closer to them, and donated them to the department and communities. That is what we need right now, working together instead of pulling in different directions. Engos.
Thank you very much, Minister. Ladies and gentlemen, we have it's time for us to take questions from the floor. We also have the Superintendent General who will also take some of the questions.
All right, there you go. A briefing, an Eastern Cape COVID-19 briefing, just giving us an update with regards to what's happening in that province. The MEC for Health, Sindiswa Gomba, speaking about the unbanning of the sale of alcohol and saying they saw a surge in the number of alcohol-related trauma cases. The MEC speaking about the loss of life in that province. 101 fatalities, 5,974 COVID-19 cases with 2,666 recoveries. So that's the situation in the Eastern Cape. All right.